It's Thursday, October 3rd, and this is the Daily Medical News, where we bring you the top clinical medicine headlines of the day, plus an in-depth look at today's biggest story. I'm Molly Collegio.
And I'm Nick Andrews. Today, does the evidence really back concerns about antidepressant adverse outcomes?
Vitamin C infusion falls short for sepsis and ARDS patients.
How symptoms vary by a patient's type of irritable bowel syndrome.
And there may be another antibiotic option when treating community-acquired bacterial pneumonia.
Plus, there is a risk factor that may prove even more dangerous than high LDL levels or obesity after a heart attack.
Relatively few of the adverse health outcomes attributed to antidepressants are supported by convincing evidence. That's the key takeaway from a systematic review by researchers at Linköping University in Sweden, who analyzed 45 meta-analyses. Their findings appear in JAMA Psychiatry. Among 120 adverse health associations, the investigators say only 3 were supported by convincing evidence. One was the association between SSRIs and increased risk of suicide attempts and completion in children and adolescents. They also found convincing evidence linking any antidepressant use before pregnancy and autism spectrum disorder, as well as associations between SSRI use during pregnancy and autism spectrum disorder. Even those links come with an asterisk, however. The authors caution that the few studies with convincing evidence didn't reflect causality, and none of them remained at the convincing evidence level after accounting for confounding by indication. The investigators also found highly suggestive evidence linking antidepressant use to a decreased risk of suicide attempts or completion in adults.
Vitamin C infusion did not improve outcomes related to organ failure, inflammation, or vascular injury for patients with sepsis and acute respiratory distress syndrome. That finding from a randomized trial runs counter to previous research that did show vitamin C reduced systemic inflammation and corrected sepsis-induced coagulopathy. Researchers from Virginia Commonwealth University in Richmond randomly assigned 167 adults with sepsis and ARDS or ARDS to high-dose intravenous vitamin C or to placebo. Overall, there were no significant differences between the vitamin C and placebo groups in 3 primary outcomes: 1, organ failure, 2, C-reactive protein levels, and 3, vascular injury. The researchers also assessed 46 secondary outcomes. Most of those showed no significant differences between the vitamin C group and the placebo group. But 28-day all-cause mortality was significantly lower in the vitamin C group compared with the placebo group.
A new survey of patients with irritable bowel syndrome highlights the symptoms that separate those with IBS with diarrhea from those with IBS with constipation. Researchers at Beth Israel Deaconess Medical Center in Boston surveyed more than 3,200 patients with IBS to explore the differences in symptoms between IBS subtypes. Abdominal pain was the most common symptom in both IBS-C patients and IBS-D patients, at 84% and 93% respectively. But IBS-C patients were significantly more likely to report that their symptoms caused them to avoid sex, feel self-conscious about their bodies, have trouble concentrating, and feel not like myself. IBS-D patients were significantly more likely to report that their symptoms caused them to avoid traveling in general, avoid places without bathrooms, avoid leaving the house, and have trouble making plans. The researchers say the results suggest that patients with different IBS subtypes struggle differently in areas of daily function, which has implications for treatment. The findings appear in the journal Clinical Gastroenterology and Hepatology. We'll be back with more medical news after this message.
Welcome back to the Daily Medical News. I'm Nick Andrews. Persistent high rates of bacterial resistance are driving a search for more options to treat community-acquired bacterial pneumonia. A new study shows the antibiotic Lefamulin may be one such option. The LEAP-2 study found Lefamulin has demonstrated activity against CAPB-causing pathogens, including some that aren't susceptible to other classes of antimicrobials. Researchers at Nebriva Therapeutics in King of Prussia, Pennsylvania, randomized 370 patients to oral Lefamulin every 12 hours for 5 days and 368 patients to oral moxifloxacin. Early clinical response rates at 96 hours were 91% for both medications. Diarrhea and nausea were the two most frequently reported treatment-emergent adverse events in both groups. Both conditions occurred more often in the Lefamulin group, but the differences were not significant. The FDA approved Nebriva Therapeutics' Lefamulin earlier this year for the treatment of community-acquired bacterial pneumonia in adults.
All lifestyle-related cardiovascular risk factors aren't equal when it comes to secondary prevention after a first acute myocardial infarction. Blood pressure, blood glucose, obesity, and LDL cholesterol may seem easy choices to assess risk. But those usual risk factor suspects for all-cause mortality, major adverse cardiovascular events, and other adverse outcomes may not be the most dangerous ones. Dr. Emil Hagström of Uppsala University in Sweden presented the results of a massive registry study at the annual Congress of the European Society of Cardiology. The study's authors examined the long-term relative importance of controlling 6 major lifestyle risk factors for secondary cardiovascular prevention. 2 risk factors that physicians often emphasize in patients with known coronary heart disease, an elevated LDL cholesterol, and obesity, barely moved the needle. Those 2 factors consistently showed the weakest association with long-term risk of adverse outcomes. Hypertension and elevated blood glucose occupied the middle ground in terms of predictive strength. That left insufficient physical activity and current smoking as the strongest risk factors for poor post-MI outcomes. Insufficient physical activity was defined as not engaging in at least 30 minutes of moderate intensity exercise on at least 5 days per week. Post-MI patients with none of the 6 risk factors had the same risks of all-cause mortality, cardiovascular mortality, and stroke as matched controls. Those with 1 risk factor not at target had 41% greater risk compared with controls. And patients with more than 4 of the 6 risk factors not at target had a 409% greater risk of all-cause mortality than controls who had never had a heart attack. Given the findings, Dr. Eva Prescott of Copenhagen University says the conclusion is that lifestyle remains at the core of prevention of cardiovascular events. And that's it for today's Daily Medical News. Remember to look for the latest episodes of Dermatology Weekly and Blood and Cancer podcasts, available today and every Thursday. For MD Edge, I'm Molly Collegio.
And I'm Nick Andrews. Thanks for listening to the Daily Medical News by MD Edge.